Dr. Ende again discussing Dr. Epstein's article on hairline lowering. Dr. Epstein does a great job of summarizing my technique with designing the hairline. His technique doesn't appear to be very much different than mine, just from reading what he has written here in this article. He does discuss, the ideal way to do this and why he does it. And I would agree with everything that is said within this article in regards to it. But he does discuss creating a widow's peak. This is certainly something that can be done at the same time as a hairline lowering. The patient often already has a widow's peak who would choose to do something like this, and usually I would maintain a widow's peak rather than create a new widow's peak. The widow's peak really is not something that most patients would request if they don't already have one, but certainly it's something that could be done at the same time as a hairline lowering. In fact, I really haven't had any patients request a widow's peak who didn't previously have one. Um, Again, this is a great procedure. Dr. Epstein does a great job of summarizing the technique of how to design the hairline. He doesn't mention the irregularly irregular hairline that most females have. He discusses it more of a straight hairline, but I'm sure that he most likely means the overall shape of the female hairline is straight as opposed to a man with temporal recessions and things like that. But when you actually look at the hairline, it does sort of curve in and out just ever so slightly because a straight line looks unnatural, even in a female. So obviously we want to have a slightly irregular hairline as we have now. If someone looks in the mirror very closely at the hairline, they'll see that it's not straight across. So we wouldn't want to surgically create something that's straight across. We want to create a slightly irregular uh, line basically encompassing the forehead. And I'm sure this was just an oversight in this article.